Health officials are investigating a possible case of monkeypox in New York City. Preliminary tests still have to be confirmed. It comes after the Massachusetts Department of Health confirmed the first case of monkeypox in this country. To learn more about this illness, we brought in Dr. Rodney Rohde. He is the Regents Professor of Clinical Laboratory Science at Texas State University in San Marcos.
Well, doctor, thanks so much for joining us this afternoon. I think we'll start with just a basic question here. What is monkeypox? A lot of folks haven't heard of this, and what are the symptoms?
Yeah, thanks a lot for having me on. Monkeypox is in the same family of viruses as smallpox, so it's a cousin of smallpox, but it's not as deadly. And it's primarily transmitted through contact, person to person, from the vesicles or the pustules that many people might remember that smallpox used to produce. So they're kind of these pus-filled vesicles that can erupt. It's actually not as transmissible as most people think, and it's not as deadly, which is a good thing. The symptoms typically are flu-like, so fever, fatigue, those types of things. You can also have, after 1 to 2 weeks, these pustules which will start developing. And that is, again, one of the primary ways you can transmit it person to person, close contact, also with bedding and linen in which those lesions may have erupted. But it's not as worrisome as an airborne virus or anything like SARS or that we've seen in the past couple of years.
Doctor, how can folks protect themselves against this?
You know, there's really, in my opinion, and most experts who are in this area are not really at, an alarm status for this particular outbreak. It's just unusual because we've seen about 80 confirmed cases in 11 countries. There's still about, I think, 50 pending cases to be confirmed, and it's clustered. So we're seeing them around different areas: Spain, Portugal. You mentioned the Massachusetts case as well as the pending case in New York. And so we're thinking that some of those cases were from an original cluster. Again, this is an ongoing investigation. And then those people traveled out to different areas and took it with them. But it's, again, important for the public to understand that the ability for this virus to jump from person to person is really low. It's called a reproductive number. It's under 1, which means it's rarely going to cause more than 1 infection. But we're keeping an eye on it and making sure there's nothing, out of the ordinary happening with it.
Well, we certainly appreciate you joining us this afternoon, easing our fears and concerns. Thank you so much, doctor, for being here.
You bet. Thank you.